The Davis LRI marker should be useful for the majority of your patients needing a limbal relaxing incision. The marker is semicircular in shape, with the two axis indicators etched on its top surface. The lower surface presents two sets of opposing triple blades. The distance between the two inner blades is 10 millimeters, the distance between the two middle blades is 11 millimeters, and the distance between the two outer blades are 12 millimeters. Each of the blades has two notches, which partitions each blade into three segments. The center segment is 30 degrees. The beginning of the outer segments measures 45 degrees, and the end of the outer segments measures 60 degrees. The diagram here shows the two sets of triple marks for a 10, 11, or 12 millimeter cornea, subtending 30 degrees, 45 degrees, or 60 degrees. The use of the marker is straightforward. A gentian violet marking pen with a beveled tip makes it easy to ink the three blades. A gentian violet marking pad does not work well since too much ink is absorbed into the spaces between the blades. I have found it easiest to first align the axis marks on the top of the marker with the astigmatic marks on the cornea. Then, after the axis is aligned, slightly move the marker radially in order to center the marker on the limbus while viewing the limbus through the gap in the marker. There are many excellent LRI markers available. However, I have found it difficult to make a smooth incision with markers that make radial lines to indicate the incision length. I much prefer markers which create a circumferential line which is easy to trace. However, these markers require one to purchase multiple instruments for different degrees and are fixed at 10 millimeters. In patients with larger corneas, and often in patients with against the rule astigmatism, where the horizontal diameter of the cornea is greater, the 10 millimeter dimension can be too short and can compromise the clear corneal cataract. It is these considerations which motivated the development of the Davis LRI marker. I hope you will find it useful for your patients.